there are a lot of things that the provincial government and the Medical Services Commission could be doing right now to enforce the Medicare Protection Act that they're not doing. All they're doing is going through this court case action. They are not enforcing the things that they could be enforcing. They could be canceling the enrollment of the physicians that are charging these extra dollars. That's completely under the Medical Services Commission rights and responsibilities. It's under their power to be doing that. They could be, they're not. They could be forcing the clinics to refund the extra charges back to the patients. They're not. They could be requiring the clinics to pay a surcharge and pay back the cost of the audit. So like a fine is called a surcharge, but it could be called a fine, and pay back the cost of the audit, and they're not doing that. The provincial government could enforce the BC Medicare Protection Act and say that there will be no public money going to private clinics. They could say that, and they're not saying that. Okay? They could come out and spread it far and wide that it is illegal in BC for doctors to bill patients for surgeries performed in private for-profit facilities. They could be advertising that fact around the province. They could be setting up a provincial call line, telephone call line, to say, if this is happening to you, you can call it in and be anonymous and tell us about it. They could be auditing the 30-something other private clinics around the province that we know are charging these fees, and they are not doing this. And so, there's lots that we could be asking them, telling them, demanding that the Ministry of Health and the provincial government do. And in fact, in Ontario, they have done some of these things. They have set up a call line to say, and advertise to say, if you're being charged privately, we want to know about it, call us and tell us who is doing this. And they're doing sort of a few other things, advertising in Ontario, the kinds of things that we're asking for here that could be done here in BC. But I guess the main point that I really want to get to is, why would having a two-tier healthcare system where the rich could pay, why would that matter to us? We know from polls across Canada that there's, up above 90% of the population polled supports a public healthcare system. But we also know that there's a huge chunk of those people that, when asked if they care whether there's a two-tier system so that the rich could pay, they say, sure, why not? We think it will take the pressure off of the public system. We think it wouldn't matter if the few rich people go off and buy their surgeries. So there's not as high of support as we would like to see for stopping a two-tier system. And so I want to talk about a little bit about why it's important that we stop it, why it's important to the public healthcare system and to the average people in Canada that we stop this move to a two-tier system. And I think that's the point. I think people don't see that having that second tier would actually erode the public system. And that's the part that is not as well known out there, just sort of in the general public. And that's the message that we need to get out there. It's not an add-on, it's not an extra, it's actually a takeaway. And we've seen this in all of the countries that have gone from a public system to a two-tier system. We've seen it in Britain, we've seen it in Australia, we've seen it in New Zealand, we've seen it in South Africa. What happens is the people delivering the healthcare services, there's only so many of those people to go around. And if they're working in the private system, they're not working in the public system. We also know that once they move to the private system, at least for the higher end private care, we'll talk about the lower end private care later, but at least for the higher end private care, they spend longer with each person, with each patient, for each consultation, for each appointment. And so, in fact, less surgeries or less appointments are being performed because the folks working in that aspect of the private system are taking long. They're not seeing as many people as they would have been seeing if they were under the public system. I'm not saying that that's a good thing for the public system for not being able to spend so long with each person, but with each patient, with each client, whatever we're supposed to call ourselves these days, with each user. But it does show that having that private system does actually take away from our public system. We know that the bigger the private system grows, the smaller the public system gets. And I think that's a huge message that people need to hear. We know from all these other countries that the waiting lists, and this is the main argument for the private system, right? They say people are waiting too long. We're not fixing the public system and people are waiting too long. So we should fix it by private. Yeah, so what we've seen is that in all the countries and in all the areas where privatization has happened, the waiting list in the public portion that's left grows tremendously. It's happened within areas within Canada. That's what happens in the States. That's what's happened in Britain, Australia, New Zealand, all these other systems that we keep talking about. It's also happening in Germany. The private side keeps talking, oh, well, there's a two-tier system everywhere else in the world. But what we're seeing in all these other European countries, the private system is growing, the public system is being diminished. Less and less money, population-wise, is going to the public system, and the waiting lists in the public systems are growing. One of the other solutions that is talked about as well, then, not everybody can afford, $10,000 for a new hip or whatever it would be in the private system. But people could buy insurance. So that's the other side of this. They want to be able to sell insurance, private medical insurance for the medically necessary procedures. And, we know from looking at the US, near to us, what happens when the insurance corporations start getting involved in healthcare. The administration costs go way up. There's all kinds of duplication and the insurance companies start trying to make the decisions about what kind of healthcare people get. The healthcare premiums go up and up and up. Co-payments get really, really high. This is what's happening in the US right now. The highest proportion of bankruptcies and people losing their homes from medical costs is for people with medical insurance. Because the co-payments, the portion that the insurance companies will pay some, they say, but the patient has to pay a chunk as well. Well, that chunk that they have to pay is too high for them to pay. So even though they have medical insurance, they can't access medical services because they can't pay their portion that they have to pay. And what we see in the US and in other countries is that co-payment portion that is the patient is responsible for goes up and up and up and up. Okay? A personal story, I lived in Australia for a short time in the mid-90s, for a year in the mid-90s. And the Australian system had been public. They had allowed a private tier, and things had kind of evened out. The private system had grown X, the public system had diminished to Y, and lots of people bought medical insurance, which at the beginning was affordable. Come the mid-90s, and there was this huge economic collapse in Australia, and all kinds of people were abandoning their private medical insurance and also couldn't afford to pay for their medical for just going in and seeing the doctor or going in and having a surgery. And so all these people were expecting to go back to the public system and be taken care of. Well, the public system was more overwhelmed at that point than it is here, and waiting lists were huge. And it was a crisis in the public healthcare system at that time. And so these are all the things, if you look ahead on what happens when you add this private tier, it does not mean that the pressure is taken off the public system. And in fact, it's actually the reverse. For most people, the public system becomes less, and they have less access and have to wait longer. We also know in the private system, as it builds up, it doesn't just stay as these boutique high-end private clinics. We got the folks that are trying to deliver services very cheaply. We just had the experience here in BC in the dentist world, right? Dentist is not publicly covered. And so there's lots of, all the dentists are private out there, and the people that can't afford the certified, the registered dentistry, they're searching out people that aren't really certified in basements to get their dentistry done. Well, the same thing would happen in medicine, and people might be forced to resort to a less expensive under the table kind of Medicare system, as we all know would have happened when abortion is not covered. They have to search for people of lower quality, possibly of substandard in terms of infection, of people that aren't registered and aren't fully qualified. That all can happen within a two-tier system as well.
If you believe that our political representatives are not really representing citizens' interests, but rather representing the interests of for-profit businesses, would you then consider the initiatives posted here on nowpolling.ca? You can go to provincial governments, click on it, and you find a whole list of topics there. The top one says Minister of Public Administration. Then you go to Minister's Mandate, the top one here, and there you have a poll. You find an initiative of legislating by referendum. Here, executive ministers become executive administrators only, without the power to legislate and subject to being recalled. Nowpolling.ca participants suggest that we, the people, become the legislators through a computerized system similar to this, referendum and recall. The question is, are you ready to participate and direct democracy?